Further amendments on the bill, Mr. Stupak.
Thank you, Mr. Chairman. It's Stupak 001. Mr. Chairman, I ask unanimous consent that the amendment be considered as read.
The clerk will report the amendment, and without objection, it will be considered as read and distributed. The amendment will be considered as read. The gentleman's recognized.
Mr. Chairman, I would reserve point of order.
And the gentleman from Georgia reserves a point of order. Mr. Stupak is recognized for 2 minutes.
Thank you, Mr. Chairman. As you know, I've introduced legislation in previous Congresses that would apply the Medicaid fee-for-service drug rebate to drugs prescribed under Medicaid managed care. I've worked with the states, safety net providers, health plans, and patient advocates to ensure that this language protects health plan enrollees, generates savings to the federal and state governments, and protects government programs from abuse. This amendment reflects common sense policy that the Congressional Budget Office said would save the federal government $11 billion over 10 years. Furthermore, the amendment provides immediate critical fiscal relief to states at the time in this economic downturn. These are savings that could be used to prevent tax increases or cuts in benefits or services in education, healthcare, or transportation. The Medicaid drug rebate ensures that state-run Medicaid programs receive the best price for prescription drugs for their Medicaid beneficiaries. Despite my belief that this amendment will provide significant fiscal relief to our struggling states and that it enjoys widespread support, I will withdraw my amendment. I want to be clear about why I'm withdrawing this amendment. It's not because I don't believe this bill can stand on its own. But quite frankly, Mr. Chairman, I'm very concerned about what I see as disproportionate influence by pharma, the drug manufacturers. How is it that we always seem to make cuts to hospitals, doctors, and rural providers, but never ask the drug manufacturers to bear their share of the burden? Mr. Chairman, it's my sincere hope that this concern over the drug manufacturers' bottom line is not going to set the mood for our deliberations over the next 2 years. And with your assurances, Mr. Chairman, I look forward to working with you in the coming months to address the concerns that you have regarding this legislation. It's my hope that we find agreement on this legislation in order to move this important legislation. With that, Mr. Chairman, I ask unanimous consent to withdraw my amendment.
The gentleman, before he withdraws the amendment, will yield to me. I want to give him such assurance that we will work together on this issue. It's a matter that concerns both of us and many other members of the committee. Without objection, the gentleman withdraws the amendment.
Thank you, Mr. Chairman.